My name is Keith Hecht. I'm a clinical associate professor at SIUE School of Pharmacy. I got my Bachelor's of Science in Pharmacy and my Doctor of Pharmacy degrees at St. Louis College of Pharmacy. I did 2 years of pharmacy residency. My first year in general practice, at the time was called a pharmacy practice residency, and then a specialty residency in oncology. Both were at the University of Kentucky Chandler Medical Center in Lexington. My first academic appointment was at University of Southern Nevada, which is now called Roseman University. And then I came here to SIUE in August of 2008 and been here ever since. My practice site is at Mercy Hospital, St. Louis. It's a large community teaching hospital in St. Louis County. And it is an inpatient oncology, which means I take care of patients with cancer that are admitted to the hospital. The most common reasons patients with cancer get admitted to the hospital are infections and pain and complications from their chemotherapy. So a lot of what I do in my clinical practice is helping patients overcome those barriers that may limit their ability to utilize chemotherapy to treat their cancer. In addition, we get some patients that are initiated on chemotherapy in the hospital, and so I help those patients with that education, and so they know what to expect from their chemotherapy, and I help the oncologist in selecting chemotherapy and maximizing its potential. For me, the decision to go with hematology oncology is a personal one. There's quite a bit of cancer history in my family, and my perspective was that the best way to try to beat it is to find out as much as I can about it. And the more I found out about it, the more I got the passion for oncology. There's a lot to draw somebody into it. There's a lot of opportunity for pharmacy. With oncology, the drugs that we use many of them are poisons, and so helping patients deal with the toxicities of those drugs so they can make it through those side effects and not have to hold back on some of their chemo is really important. The other thing I really love about oncology is it's constantly changing. My lectures from year to year aren't the same because I've got to incorporate new drugs, and every day poses a new challenge that we have to deal with. My research interests are in supportive care primarily, so once again helping patients handle the side effects of chemotherapy. And so most of my research in my clinical practice, I actually try to involve students as much as possible through the capstone experience and then through other just opportunities to get students involved in research. We've done several projects looking at the way we're utilizing medications, including antiemetics for our patients with nausea, vomiting, and other supportive care medicines for our oncology patients as well as our hematology patients. And the students I've worked with have gotten the opportunity to present that research at national pharmacy meetings. For me, the reason supportive care is such a draw is because chemotherapy is extremely hard on people. It works by killing cells, and it's going to kill those cancer cells, which is what we want, and it's going to kill normal cells and cause significant side effects. And for many patients, that can cause them to not want more chemotherapy. And we know that if we can keep that chemotherapy on time and at the dose we need it, that we enhance the patient's likelihood of getting into a remission. So for me, academia is something I was interested in from the very early stages in pharmacy school. I've always kind of had the teaching bug is what my professors referred to it as when I was in school, including being a TA in labs and tutoring. And for me, my perspective is that pharmacy is all about teaching. So if those of us in community pharmacy or hospital pharmacy, we're teaching someone about medications, whether it be the patient or the other healthcare providers. For oncology, I think it's especially important because I tell my students at the very beginning, my primary goal for them isn't to turn them into cancer pharmacists or oncology pharmacists. It's to make it so they're not afraid of an oncology patient and make sure they have the knowledge to help patients optimize their medications. My teaching philosophy for pharmacy students really comes down to one thing, and that's making sure that the students aren't afraid. And so that comes from not wanting them to be afraid of dealing with cancer patients, but also not being afraid to not understand things and not be afraid of their own shortcomings. And that way we can face those difficulties that may have together. And so I try to create an environment as safe as possible. And so I know all of my students' names. It's a conscious effort that I make so they know I care about them and that I am interested and invested in their success. The thing I love most about teaching is when students make that flip from not following what I'm saying to actual comprehension, and then being able to take it beyond that and come up with questions that go beyond what I've covered in class. Just seeing that recognition, that spark of recognition, is very rewarding. And then also, I love seeing when I inspire pharmacy students to go into a career in oncology. It's a very particular type of person that goes into oncology, and so when I see people get that interest, it's really exciting for me. The most important piece of advice that I could pass along to pharmacy as a profession is that we really need to make sure that we are embracing change. And so that's one of the things that's really difficult, because change can be scary. And so whether or not it's change related to government regulations, change related to payer source, change related to new medications, change is all around us. And so if we run from it and try to hide from change, we'll get left behind. And so as a profession, we need to make sure we're embracing it. And that starts with students. And so, bringing information to students in new ways, so they aren't just used to one type of teaching and learning. And then that extends out to when you're in practice. And so we have to make sure we're embrace change and be part of that change, otherwise we'll get passed up.